So today it's all about exosomes. These are the hottest thing in medical aesthetics just now, and they're tiny messenger particles which communicate between cells and cause immense regeneration in the skin. So I'm going to try a treatment, and I've come to Harley Street to meet Dr. Anoob Pakkar-Hull, and I'm going to talk to him about it, find out what exactly these particular exosomes can do. They're called Purasomes. They're from an Italian brand called DermoAroma, and if you come with me, we'll find out all about it. So Anoob, these Purasomes, they're a kind of exosome, aren't they?
Yes, Alice, they are exosomes. So exosomes, as you know, they're nanovesicles, which are layered with fat or lipid, which helps in penetration of a skin barrier, and it allows to carry cargo to the target cells wherever we're going to deliver it.
Okay, so they can regenerate the skin, and exosomes are derived from different sources, aren't they? Could you tell me a bit where you can find exosomes and what kind of exosomes these are?
So essentially, all eukaryotic cells.
What's a eukaryotic
So
cell?
any cell which has a nucleus
Okay.
can release exosomes. So, you have it in, for example, the human-derived ones. You can get it from the blood, bodily fluids. You can get them from animal-derived, from milk, and also plants. So these Purasomes come from colostrum or bovine colostrum.
Bovine colostrum, okay. And that has synergies with human skin?
It does actually, because it has more growth factors than the human exosomes.
So it's derived from colostrum. And how do Purasomes work as a treatment?
So because it's the exosomes, they carry cargo and they're so small, applying it either topically or introducing that into the skin, it's able to reach the target area quite quickly.
What's the target area?
Your skin. So
okay, the fibroblasts?
When you age, you have dyspigmentation, the dermis and epidermis sort of lengthens, becomes thinner, pores become larger. So what exosomes does is it gets in there, it stimulates fibroblasts, and that's the building work for collagen. It also creates new blood vessels. So it increases the thickness of the dermis itself. So it helps in pure cellular regeneration.
Okay, so will that mean fewer fine lines and better hydration and things as well?
Yes, it does. You will sort of start to see better texture, better tone, decrease in pigmentation. It improves fine lines.
What does the treatment with Purasomes look like?
So a good way to introduce Purasomes is via microneedling. So microneedling allows us to, it creates those channels, and then the Purasomes applied topically would then be able to go through those channels into the skin, working its way from the stratum corneum right to the dermis.
Right, and once they're in place, how long does it take to start to see a result?
Generally speaking, I'd say about 30 to 60 days where you'll start to notice a difference. There's nothing instantaneous. I mean, yes, of course, you will see the benefits of microneedling fairly straight away, but for the exosomes to work, it's the regenerative product. So you have to allow the cells to start again.
Okay, and it takes more than one treatment, presumably, to get the best results?
Yeah, ideally 3, sometimes 4 treatments, at least about 3 to 4 weeks apart.
Okay. So if you're microneedling as well, how are you telling which results are coming from the microneedling and which ones are coming from the Purasomes?
So this is the reason we use like dynamic cameras to actually look for pigmentation changes on vascularity. We're looking at age spots and lightening of age spots, line wrinkles. So yes, you will get a few things which are microneedling, but the inner part is done through exosomes. And also bear in mind the microneedling is done at just a millimeter.
Oh, okay.
So it's not like a deep level.
So it's not going to be uncomfortable. I'm really concerned because I'm going to try this.
Hopefully not.
Okay, terrific. Will I need numbing cream?
Well, I actually give the options to my patients to have it or not. In my experience, they tried it with the numbing cream the first time, and the second time they've sort of gone without it and tolerated it well.
And what sort of price does this treatment start from?
So the prices vary from clinic to clinic, but our prices start from £500 per session.
So why would you choose to have a Purasomes treatment rather than a treatment with a hyaluronic acid-based skin booster or with polynucleotides? Because those are also regenerative treatments. So where does Purasomes stand out?
That's a very good question, Alice. So I think, by its own, they are really good treatments. But what Purasomes have, it has all of it. So you have polynucleotides in the Purasomes itself, and it also has a lot more growth factors, all of that cargo getting into the skin. Whereas, with skin boosters, you're looking at just HA.
Sure, there's just hydration and the benefits that
yeah.
bring. So it's a kind of bigger hitter of a treatment. And I'm sure I read something about it being good for the skin thickness, the skin health of that skin barrier.
That's right, yes. So the junction between your epidermis and dermis, that becomes thin. That's a natural sign of aging. Yeah. So exosomes, by generating new cells, new blood vessels, it actually improves the thickness. And you can start to see that even after the first, about 20%, you can see the thickness increasing after the first treatment.
Sounds what we all need. In order to see the change this is going to make in my skin, I'm going to have a Visier treatment. Do you do that with most patients?
I think it's important with Purasomes because I'm not anticipating to give you a glow or just a shine or treat your lines. This is a deeper level, more of a anti-aging skin regenerative treatment. Okay. And to really clearly see the difference, you need something like a Visier to see what's happened to the pigmentation or particularly the anti-inflammation.
Okay, for sure. You need that data, don't you? And this is a treatment that's new to the UK, but it's not a new treatment as such, is it?
Correct. I mean, Exosomes per se is still relatively new. It was only discovered in the 80s, but DermoAroma have launched Purasomes in Europe. They're operating in about 44 countries, I think. And there's loads of procedures. However, it's being launched in the UK for the first time.
So this is me immediately after my Purasomes treatment, lightly red from side to side from the microneedling, but it's not bad. And I'll be back for 2 more rounds of treatment at 3-week intervals. And by the 3rd one of those, I certainly hope to be seeing what this treatment can do. So that's Purasomes, and thank you very much for watching.